Welcome to our special webinar today. I am Joy Pumapi, Executive Secretary of the African Leaders Malaria Alliance. Before we start, I just want to let you know that this webinar is available in English, French, and Portuguese. You can select your preferred language by choosing interpretation from the black bar at the bottom of the Zoom window. If you have any questions, please use the Q&A feature in Zoom, and a member of the ALMA team will be pleased to respond. We thank you for participating. Last month, our chair, His Excellency President Umaro Sissoco Embaló of the Republic of Guinea-Bissau, launched the ALMA Joyce Kafanabo Awards for Excellence and Innovation on the sidelines of the AU Summit. Today, we will be celebrating the winners of these inaugural awards. Our chair established these awards following the tragic passing of Joyce Kafanabo in early 2021. Joyce was a founding member and senior director at the African Leaders Malaria Alliance, and she had dedicated her working life to the diplomatic service and the fight against malaria on the African continent. Joyce spent her entire career working tirelessly to help create a better future for all. Earlier in her career, Joyce served as Minister Plenipotentiary for the Permanent Mission of the United Republic of Tanzania to the United Nations, where she aggressively advanced the health agenda. With her time at ALMA, Joyce focused on fostering and cultivating partnerships towards ending malaria and neglected tropical diseases and addressing maternal, newborn, and child health on the continent. She always led with her impeccable character, kind, loving, and compassionate, focused on improving the health of citizens across the African continent. A dedicated mother and grandmother, Joyce has 4 daughters, a son, and much adored grandchildren. Within her family, Joyce was a beacon of light, always there for her family and the local community. Joyce served the United Republic of Tanzania and the African continent with distinction. We hope these awards will play a small part in honoring her legacy and inspire future generations to drive the health agenda forward and eliminate malaria and neglected tropical diseases for good. Here is a short video of Joyce's family, friends, and colleagues celebrating her extraordinary life.
My favorite memory of ALMA Joyce Kafanabo would be her warm heart. She was someone who's always welcoming. She was also open to let someone grow.
Joyce was a touchstone for me. She was my on-the-job mentor, friend, confidant, and thought partner.
Joyce Kafanabo was my friend and my colleague. She was a bundle of fun. I will miss her forever, but I am delighted that her name will continue in all of our hearts and in all of our thoughts, but I'm super delighted that we have these awards in her memory.
I remember Joyce is very level-headed, consumer professional, diplomat, very dedicated to and passionate about our work. She had a very fun-loving side. As a grandmother and as a mother, she was very completely committed to her family. She really is greatly missed by the ALMA team.
I first met Joyce Kafanabo in New York, Minister Plenipotentiary in the Permanent Mission of Tanzania. But Joyce was one of those people who created the building blocks for other people to stand on and other people to shine. And she was so happy when it worked out. She left us far too soon, but she left a legacy, which for me is an honor to remember. Thank you.
ALMA would not be here today without Joyce. I enjoyed the privilege of watching Joyce at work up close. She taught me so much through her example. Joyce drew from a broad range of talents: wisdom, diplomacy, strength, tenacity. Most importantly, she always operated with kindness and respect.
Joyce Kafanabo was an extraordinary daughter of the African continent. She was a pathfinder who had a vision of creating the Africa we want. It was a privilege and an honor to have her as a friend and as a colleague.
She was a giving person. She renovated the maternity ward at the village. She made a contribution of music instruments at the church. Before she passed away, she was making plans of having desks at the school that is in the village. Me and my siblings made sure that we did deliver about 30 desks. We felt it was necessary for us to also make sure that those desks get delivered at the school.
The Joyce Kafanabo I knew, a very enthusiastic and committed person in everything she undertook to do. She was a diplomat at Tanzania's permanent mission to the United Nations in New York, where she was responsible for the third committee, which deals with issues of social development. Joyce worked tirelessly to promote ALMA in Tanzania and gave ALMA the needed and deserved visibility in our country and beyond.
Joyce deployed her fantastic skills to ensure that ALMA was created. She had a fantastic sense of humor. She was always smiling. She had a steely determination. She worked so hard to make the world a better place. I am delighted that the Joyce Kafanabo Awards have been created in her memory. Thank you.
The awards celebrate countries that have made the most progress on digitalization, strengthening their scorecard tools through public sharing, capacity building at the subnational level to enhance data-driven decision-making, and empowering citizens to improve health services and outcomes at community level. The award winners were chosen by an independent awards committee made up of leaders in malaria, in maternal, child, adolescent health, youth engagement, and the broader health and development sector. We would like to express our gratitude to the committee members who diligently reviewed the candidates, selected the winners, and helped us honor Joyce's inspiring legacy. Thank you, Pamela Amaka Anyia, Dr. Dadi, Yima Mayesa, Leah Kibe, Whitney Mwangi, and Yasin Jibo. The committee was guided by an assessment of each country's scorecard using the ALMA Scorecard Maturity Assessment Tool, which helps identify where a country scorecard is performing well and where it needs further improvement. Countries can visit the ALMA Scorecard Hub website to complete their own scorecard maturity self-assessment and improve their scorecards. I would now like to welcome our two special ambassadors, Ambassador Professor Sheila Tlou and Ambassador Anthony Okara, to announce the winners. Ambassador Tlou, over to you.
Thank you, Joy. It is my pleasure to celebrate the 4 countries that have won the awards for the best malaria, reproductive, maternal, newborn, child and adolescent health, that is RMN, CAH, neglected tropical diseases, and community scorecard tools. These awards recognize the best use of scorecard tools, and we are celebrating these countries, those very countries that are decentralizing scorecards to subnational levels, using their scorecards to drive accountability and action, and linking their scorecards to national health management information systems such as DHIS2, and sharing the scorecards publicly on the ALMA Scorecard Hub. Our first award recognizes the best use of malaria scorecard tools. I am pleased to announce that this award goes to the Republic of Zambia. One Zambia, one nation has decentralized the malaria scorecards and used innovative tools such as the scorecard web platform's work plan manager to provide the National Malaria Elimination Program and National End Malaria Councils with access to real-time information for decision making. This has led to significant increase in meeting the operational plan, implementation targets, and indeed, here is a short video about Zambia's malaria scorecard.
Over the past 10 years, Zambia has made significant progress in reducing the malaria burden. However, the disease is still a major public health challenge and remains endemic across all 10 provinces. To improve its performance in tackling malaria, the Zambian government and its partners have further developed the use of the malaria scorecard, first adopted in 2016. Not only does the scorecard allow the government to track progress against key malaria indicators nationally, but Zambia has expanded its use to focus action at the regional level as well. The scorecard is also reviewed every quarter by the End Malaria Council. Convened by the President of the Republic of Zambia and chaired by the Minister of Health, the End Malaria Council is comprised of representatives from government, business, and the community. Having such a high-level forum review, the scorecard has led to significant action. For example, in October 2019, the National Malaria Elimination Center presented the scorecard at an EMC meeting and outlined that one key indicator was underperforming. This indicator tracked how many pregnant women were receiving 3 doses of a drug to prevent malaria during pregnancy. Commitments were made, and by the next meeting, it was confirmed that 2,450 tins of SP worth $230,000 were received and distributed to the provinces. In 2018, Zambia was the first country to pilot the scorecard's new functionality, the Work Plan Manager tool. This new feature allows all provinces to harmonize and upload their work plans. Government at national, provincial, and district level, as well as their partners, are now able to follow the implementation of the planned activities, review performance, and identify and address bottlenecks. The Work Plan Manager feature has led to a significant increase in Zambia's 2019 operational plan implementation rates. An 80% implementation rate was achieved in 2019 compared to the average of 36% that was achieved in 2016 prior to the rollout of the new tool. With innovative tools such as the Malaria Scorecard and its Work Plan feature, Zambia has become a leader in evidence-based decision-making. These tools have strengthened the government's ability to coordinate partner support, improved data quality, and led to increased resources to achieve the ambitious goal of malaria elimination by 2023.
I'm honored, truly honored, to receive the 2022 Best Malaria Scorecard 2 Award. I didn't expect it. Maybe I don't deserve it, but I'm really, really thankful on behalf of my fellow citizens, citizens of Zambia, and indeed others who are toiling, working very hard to bring malaria under control. So I'm extremely, extremely delighted for this honor on behalf of our country. Additionally, I wish to express my appreciation, our appreciation, to the independent committee for identifying Zambia as a deserving recipient of this inaugural award. Our country, Zambia, has been recognized for the best use of scorecard tools in the fight against malaria. Our approach, I must say, ladies and gentlemen, is focused on decentralizing malaria scorecards to subnational levels, linking the scorecards to high-level multi-sectoral efforts in malaria elimination, and sharing the scorecards publicly on the ALMA Scorecard Hub. Recently, as a country, we've made great progress on digitization. I know we need to do a lot more, but we're making good progress, and institutionalization of the tools through existing accountability and coordination mechanisms. This, for us, it allows us the opportunity to provide real-time data, data which is important for decision-making as we continue our efforts to control malaria. And this also helps us to improve, of course, health service delivery to those that need health service support, and they are scattered across the country. Our country may not be defined huge, but we sit on 752,000 square kilometers of landmass with lots of water bodies. Challenges of accessing, for our people, health service delivery are huge, but this is one of the areas that we're paying particular attention, including information sharing. The National Malaria Elimination Center in our country, with the partners that have worked diligently, with our partners that have worked diligently to ensure that the scorecard is regularly updated and shared publicly, it's important to say thank you to all of us. And I think this award is really their award, not mine. I'm just the semblance. I'm just the representative. The scorecard has also been a useful tool for action and indeed resource mobilization by the End Malaria Council, our End Malaria Council, which is a multi-sectoral, country-led body pursuing advocacy, resource mobilization, action, and accountability in terms of what we do towards malaria elimination. We take pride in mentioning that Zambia was the first country to use the ALMA supported scorecard. And you will see that on our web platform, work plan management tools that we use. We have used the scorecard, and I think we found it very, very useful as a tool. It would be remiss if I did not take this opportunity to congratulate our Minister of Health, Honorable Masebo, who is in the room here today, and indeed our hard-working team in this space at the National Malaria Elimination Center, and all the partners and indeed collaborators, if I may define them as such. But let me give special recognition to our grassroots workers, those that are hardly mentioned in platforms like this. I know they are listening, and I know there are many. And I know they are there in your own country, and many a time they are ignored. We would like to recognize them, that without their efforts, under challenging circumstances, as I described in our country, crossing rivers, sometimes with these floods, our rivers are being blown out, too much water, too much rain, flash floods, but they are there. We really want to thank them, and through this award, recognize them. I would like to thank the ALMA for the support they provide to our countries, not just Zambia, all our countries, and look forward to continued collaboration. And Zambia commits to sustain the use of the scorecard tools. And I wish to appeal to other countries to do likewise. And probably they're already doing it. But those that are not doing it, here's an appeal directly to you. Please take on board these tools. And it will be probably easier to work using these tools at your hands. I also wish us to request that we publish the scorecards and best practice on the scorecard hub as a matter of routine, as a matter of habit. And I think then we can benchmark, we can learn from each other, and through there, we can effect or inject some improvements to what we are already doing well. And the benefits will be to our people, our citizens. Obviously, malaria is a big killer, still a big killer. And we want to save someone's life by doing something properly, effectively, and then what I may call continuous improvement should become part of it. I wish to thank all of you for listening to my message, my short speech, but also to my colleague there, seated there, and others that work with him for the wonderful initiative. Thank you so much. God bless you all.
We congratulate the Republic of Zambia for winning the Best Malaria Scorecard Tool of 2022. Like our noble eagle in its flight, you are soaring. Well done. Our next award recognizes the important role of scorecard tools in advancing reproductive, maternal, newborn, child, and adolescent health. Allow me to congratulate the Republic of Kenya for winning this award for the best RMN CAH scorecard. Kenya has decentralized the scorecard down to county level and shares the scorecard data with key county planners at national, county, and health facility levels. At county level, the scorecard is used extensively in existing accountability mechanisms such as county performance review meetings and sub-county data review meetings. In these meetings, the scorecard is reviewed and actions are generated and entered into the scorecard web platform's action tracker. Please watch this video about what is happening in Kenya.
Kenya has been using a scorecard, a management tool used by 46 counties across the country to track key health indicators and drive action and accountability.
We use it on a day-to-day. We use the data we get from it to make management decisions in this sector.
Kenya's strategy has a strong focus on improving health outcomes in its rural regions. When monitoring health interventions, counties such as Homa Bay, Siaya, and Bungoma, which are far from the big city, can be a challenge.
We have over 260 health facilities in Homa Bay County. Some are hospitals, some are dispensaries, and they offer reproductive health interventions. So it is important that we have a method of tracking down our interventions.
The scorecard has helped county and district health managers identify problems and address them.
Using this tool, we were able to identify that we had serious challenge on deliveries at Bondo Sub-County. The challenge was that there was no resident gynecologist in that facility, and therefore a lot of our mothers who went to deliver in the facility were facing some challenges.
Meanwhile, Bungoma was facing other challenges in its maternal health care cover.
We have challenges, and when we discuss how we have performed using the scorecard, it is evidence-based. Generally, we have not done well in postnatal checkup, that is within 48 hours, and also that is 4 to 6 weeks.
The scorecard's simplified traffic light color system has been a huge benefit to the health management team.
What is very outstanding about it is the use of color rather than complex figures that ordinarily we use in the conventional way.
When you see a sub-count which is in red, it means they have not done well. When it is in yellow, it means...
While in the red, Christine and her team were able to act. 400 additional birth attendants have now been trained in the county, and the scorecard is helping Kenya improve public health policy across different sectors.
We are endeavoring to integrate it with the other systems that we have, particularly creating linkages between health sector and other aligned sectors that also deal with matters that relate to mother and child, like education, agriculture in terms of nutrition, and all that.
This healthcare integration has also allowed Bungoma to improve their immunization program.
It has simplified the manner in which we gather data and process data and use it.
As a team, we want to learn what are the best practices.
We have used it often and we will continue to use it.
The scorecard is helping shape the future of public health across Kenya.
I stand before you with deep humility to accept, on behalf of the government and the people of Kenya, the award of the African Leaders Malaria Alliance Joyce Kafanabo Award for Excellence and Innovation, which recognizes the best scorecard in reproductive, maternal, neonatal, child, and adolescent healthcare. I would like to extend, Your Excellency, my profound gratitude to my dear brother, His Excellency Umaro Sissoco Embaló, President of the Republic of Guinea-Bissau and Chair of ALMA, for his steadfast commitment to excellence, efficiency, and integrity in governance, and to disciplined and orderly service delivery for development. I recognize, Your Excellency, that these commitments demand singular devotion to transformation, urgency in pursuing positive change, and innovation as a habit of mind. I also appreciate, Your Excellency, your thoughtfulness in establishing this award and for naming it after an exemplary African woman. Joyce Kafanabo not only embodied the values celebrated by this award through selfless service and commitment to excellence, she also exemplifies the extraordinary burden that rests upon the heads of Africa's women and the tremendous promise that will only be actualized through their recognition, inclusion, and participation in full. The people of Kenya are very proud of their achievement in innovating their way out of disease burden that has encompassed many generations, cutting short millions of lives and extinguishing countless dreams. We appreciate this powerful affirmation of our long struggle, unwavering determination, noticeable progress, a measure of victory and infinite hope in our effort to eradicate malaria. Beyond working very hard to eradicate malaria, we in Kenya found it appropriate to optimize the effort by making it systemic, consistent, disciplined, and orderly. By institutionalizing our scorecard tools and deploying technology to enhance data-driven decision-making, we empowered our stakeholders and the citizens most of all. As a result, the provision of health services on one hand and health outcomes on the other significantly improved on a sustained basis. It is largely by employing technology and innovation that my country has made undeniable and significant progress in informing and engaging communities on maternal, neonatal, child, and adolescent health, and in the fight against malaria and neglected tropical diseases. We are proud to be recognized as leaders in the global best practice of scorecard decentralization. The use of technology in implementing a decentralized scorecard conforms to the cardinal governance doctrine in Kenya. First of all, devolution and decentralization is a national value whose implementation has unleashed immense transformation in many vital areas throughout the country. Secondly, the government considers technology to be a fundamental enabler of bottom-up socioeconomic transformation, so that through digitization, automation, and innovation, we intend to quickly become an effective government for a digital economy. Our scorecards are anchored on the Kenya National Health Sector Strategic Plan and are aligned with our vision to achieve universal health. They also comply with the Kenya National Vision 2030. Thus, the scorecards are dynamic and customized for effective deployment at the county, sub-county, and individual health facility level. They facilitate the effective tracking of progress in terms of priority health indicators and also in terms of specified desirable outcomes. Apart from assisting evidence-based decision-making, the scorecards also enable the execution of appropriate and timely response to service gaps and operational bottlenecks. This has led to the reduction of social and geographical disparities in access to health services and improved health systems performance. A critical dimension of the scorecard in action, which I must share with you, is its emergence as a powerful advocacy tool in its own right. By demonstrating that it is inclusive, it's participatory, sustainable, transparent, and accountable, the scorecard has provided necessary comfort to stakeholders, thus enabling us to mobilize the support on a broad array of partners. I'm also therefore proud and honored to acknowledge the invaluable support and contribution of our many partners, without whom this achievement would still be work in progress at best. I conclude by expressing our unreserved confidence, Mr. President, on our ability to totally eliminate malaria through collective action. All of us, we that are gathered in this place and everyone else, have the power to make a contribution towards the achievement of zero malaria. Let us get started and keep going until the job is done. Thank you very much, and may God bless you.
Hongera sana to the Republic of Kenya for the wonderful progress you have made with your RMN CAH score. Country scorecard for neglected tropical diseases only started in 2017, but many countries are making extraordinary progress. It is my pleasure to announce that the award for Best NTD Scorecard goes to the Republic of the Congo. They were the second country in Africa to roll out a neglected tropical disease scorecard in 2019. The scorecard helps them with collaboration and coordination of national stakeholders, monitoring and implementation of interventions, identifying service bottlenecks and national priorities, and stimulating action. As an example, when the NTD scorecard identified gaps during the analysis, the National NTD Program mobilized funds for the government, and from 2020, a budget line for the NTDs was created with a commitment of 100,000 million CFAs. That is in francs, roughly US 70,000, that was tagged to support the 4 NTD programs. Here is a short video about the successes of the Republic of the Congo that has been made with the NTD scorecard.
The neglected tropical diseases, NTD as an acronym, are a set of 20 diseases currently considered by the World Health Organization, WHO, and linked to poverty that mainly affect populations of tropical and subtropical countries. Already, in the blink of an eye, the scorecard pulls out for you the districts that have done well, the districts that seem to be lagging, and the districts that did not perform well. So all of a sudden, the health worker who looks at their scorecard already knows that, for me, it did not work. And that pushes them to go for a more in-depth analysis to find solutions to this. So, several health workers are trained on the best practices to use the scorecard. Epidemiological surveillance data from health districts are loaded into the scorecard by data managers. This filled in, the scorecard can be viewed by decision makers on 3 axes of accountability: review, action, and follow-up. So, they can in turn react and make the necessary decisions to eliminate and control these diseases. The scorecard also helps mobilize resources. Thanks to the report we share with partners, we have observed a marked improvement in our budgets, particularly with the WHO-PH. In Congo, the scorecard is experiencing gradual decentralization. It is used by high-level actors at the level of the Ministry of Health, advisors, programs, NTDs, and SNIS at the county level by administrators and data managers.
Avec la vision de soulager le Congo.
With the view of relieving Congo from the heavy burden caused by these diseases, the ministry in charge of health requested from the ALMA platform a technical and financial assistance to decentralize the scorecard on neglected tropical diseases.
De la carte de score sur les maladies tropicales.
Congratulations to the team in the Republic of the Congo for their success with using the NTD scorecard to drive action. Next is the award for the best community scorecard. Community scorecards are powerful social accountability mechanisms that bring together a diverse range of community members to provide feedback on the quality of health services offered at their local health facility. Several countries have introduced community scorecards, and many other countries are in the process of launching their community scorecards. For this inaugural award for the best community scorecard tool goes to the Federal Democratic Republic of Ethiopia, who launched their community scorecard in 2017 and is now used extensively in the country. It helps to monitor 2 flagship initiatives: the Wareda Transformation Program and the Primary Healthcare Improvement Program. It is used to mobilize technical and financial support, including increased contributions from community members, partners, and the government. Let's learn more about this great project from this video.
In the rural areas of Ethiopia, an exciting new citizen participation and feedback process is gaining attention and wielding impressive results. In less than 2 years, primary healthcare units have more skilled staff and ambulances that are stationed closer to the communities. District assemblies are providing focused and timely support to health centers. And most notably, citizens and communities are joining the Ministry of Health as co-partners to improve the quality and accessibility of health services as never before. In support of the Ministry of Health's commitment to social accountability, and as part of successful implementation of the Health Sector Transformation Plan, a new citizen feedback process and tool called the Community Scorecard has been developed. Best practices include fully institutionalize the Community Scorecard into routine government systems. In Ethiopia, this has been done by incorporating the scorecard into the official Joint Supervisory Visit Checklist, which is used during semi-annual Ministry of Health support visits to facilities. The CSC is also a standing agenda item for routine quarterly performance review meetings that are organized by the zones with the districts. And the CSC scores are one of the official key performance indicators, or KPIs, in the government's health sector performance monitoring system. Another best practice is to ensure the CSC tool remains measurable and comparable. Also, keep costs low and utilize domestic resources to the extent possible. Encourage regional tailoring of the national guidelines to build regional ownership, take into account regional context and capacity, and to translate into local language. Ensure the CSC process is genuinely citizen or community-led, and that citizens providing feedback represent the diversity of the community. In Amhara region, this has translated into no staff or volunteer cadre of Ministry of Health workers being present during the community feedback meetings and scoring. Another best practice is to consistently hold feedback and scoring meetings to keep the momentum going. Don't skip a quarterly meeting. Another best practice is to update the action plans at the health centers within no more than a week after each round of citizen feedback, and to quickly implement as many agreed actions as possible. According to zonal officials, for at least 80% of the issues raised by the community, the health centers have had the capacity and the authority to implement the required actions without help from higher Ministry of Health levels. One additional consideration is to offer no or low-cost incentives to motivate health workers and promote community contributions. These incentives can include health worker recognition during routine staff meetings, certificates, posted photos of Employee of the Quarter, and the naming of one staff member to serve on a rotating basis as the caring, respectful, and compassionate ambassador. Despite the CSC being still quite new, lessons for program improvement are beginning to emerge. Some key lessons include the need to adjust the proposed CSC indicators to include cleanliness and safety of health facilities, the need to develop a self-training video to reduce the cost of future staff training, and the need to involve partners earlier to expedite scale-up and learning. In conclusion, the Ministry of Health is keen to continue to scale up the Community Scorecard experience in all of its rural regions in the country. The Ministry of Health plans to accelerate scale-up in the 3 other populous regions of the country and reach another 600 communities by the end of 2019. The ministry plans to initiate pilot activities in the remaining 5 rural regions and to modify the approach for pastoralist areas. And finally, the Ministry of Health is committed to continuing to learn, document, and generate knowledge on sustainable citizen feedback and social accountability processes in the health sector.
We congratulate the Federal Republic of Ethiopia for trailblazing the community scorecard approach. I will now hand over to my colleague, Ambassador Anthony Okara, to announce the final 3 winners in this inaugural ALMA Joyce Kafanabo Awards for Excellence and Innovation.
Thank you, Ambassador Professor Sheila Tlu. It is my pleasure to introduce the final 3 awards, which focus on institutionalization and innovative use of scorecards. Firstly, the award for the best institutionalization of the scorecard tools across malaria and reproductive, maternal, newborn, child and adolescent health award recognizes countries that have made a consistent effort in institutionalizing and mainstreaming scorecard tools at all levels and across vertical health programs. It's my honor to announce that this award goes to the Republic of Rwanda. Rwanda has regularly taken innovative approaches to their scorecard use, such as their integrated malaria and NTD scorecard, along with their RMNCH scorecard. The 2 scorecards are identified in the country's strategic plan as key performance and management tools to track progress of indicators linked to their priorities. The scorecards are discussed at technical working groups with various partners and stakeholders to identify underperformance and develop actions to improve. So this short video highlights how Rwanda has institutionalized their scorecards for greater impact.
Rwanda's drive to improve public health has seen it embrace innovative tools such as the scorecard, a management tool that facilitates data tracking to improve decision-making. As well as being part of its strategic plans, Rwanda's implementation of these scorecards across different sectors has become a model for other countries to follow.
The way the scorecard is designed, you can see where you are performing well, it is in green. Where you are in progress but you need additional effort, it is in yellow. Where really you are behind, it is in red. It's easy to track our achievement and to see persisting gaps by different areas or by different location. It helps to us to mobilize the resources.
Those resources are mobilized by planning meetings in different forums to understand what has been achieved and to plan for interventions.
Coordination meetings brings together stakeholders from health centers, and we can also invite the health post managers and representative of community health workers, because part of what we discuss in the coordination meetings is the work of community health workers.
Community health workers play a huge role in delivering Rwanda's community family planning strategy.
We do door-to-door visits to pregnant women to educate them, to get them to make their first antenatal visit in the first 3 months of pregnancy. We also tell them to start thinking about family planning. After training them, the health center sends them home to their villages, where we continue to monitor them.
Alongside its success in using the scorecard to improve maternal, infant and adolescent health outcomes, Rwanda has successfully used the scorecard management tool to fight malaria. Over the last 5 years, Rwanda has faced a malaria upsurge. Over 5 million cases were recorded across the country, with over 700 people dying from the disease.
Ever since we started using the malaria scorecard, we have been able to track the level of malaria cases in each sector. So it is possible to know which sector has the highest rates in the month, and therefore where to spray and where to run awareness programs and training for community health centers to better assist the residents.
Rwanda's anti-malaria interventions, from simple measures such as early diagnosis, the distribution of bed nets and household spraying, have been complemented by additional high-tech solutions.
In the malaria sector, what we do, we map areas where we identified breeding sites for mosquitoes, and then we deploy drones to also spray larvicide in those areas, killing the mosquitoes at a really early stage.
All of these interventions have been informed by the use of the scorecards. By tracking the progress both in combating malaria and in maternal, infant and adolescent healthcare, the government has been able to target its resources more effectively and thereby make progress in public health.
Rwanda's progress in malaria is indeed a success story because Rwanda has got a vision to have a country free of malaria.
So all this will help us to improve on the delivery of the interventions, for improving policy direction, for strategic planning, and ensuring that we deliver quality services to the population at large.
Congratulations to the Republic of Rwanda on the great work with the Integrated Malaria and NTD Scorecard and RMNCAH Scorecard. Our final award for the ALMA Joyce Kafanabo Award recognizes innovative use of scorecard tools. This category was so competitive that we had to decide to celebrate 2 winning countries. Therefore, it is my honor to announce that the awards for the best innovative use of scorecard tools goes to the Republic of Ghana and the United Republic of Tanzania. Ghana is the first country to include quality of care community-generated data from the Community Scorecard tool to the DHIS2. Through this, most stakeholders can access community data and it can be aggregated to the sub-district, district, regional, and national level. Significant action and resource mobilization by communities and partners has also been documented through this process. Please watch the video about Ghana's innovation in this area.
In January 2018, the Community Scorecard was introduced by the Ministry of Health and the Ghana Health Service with support from the African Leaders Malaria Alliance, ALMA. The Community Scorecard is an accountability tool that allows community members to provide quarterly feedback on health services and create action plans to address bottlenecks. The Community Scorecard consists of 2 main components: a scoring session during which the community members provide feedback on 9 indicators related to the quality of health services in their CHIPS zone, and importantly, the development of Community Health Action Plans, CHAPs, to address the issues identified during scoring sessions. Every CHIPS zone is supported by a group of 7 to 13 community leader volunteers known as the Community Health Management Committee.
The Community Health Management Committee are supposed to be supporting the design and the delivery of the services at the community level with the support of the CHO, and the volunteers moderate among them.
Before the community scorecard came, there were challenges getting feedback from patients as part of input for improvement.
All of the things that we are doing is to move towards quality improvement. But as I said, initially we were just looking at the supply side of business. That is, how are we performing as a health sector? But then the gap was, how do those that we are offering the service look at us in terms of quality? Because technical quality can be very different from experiential quality. So then the community scorecard was then set up, asking some very basic questions.
The Community Scorecard initiative has been rolled out in 10 regions of Ghana: the Ashanti region, Western region, Bono-Ahafo region, Central region, Volta region, Oti region, Northern region, Savannah region, Greater Accra, and the Upper East region.
Having rolled out this tool and having gone around for monitoring and having taken feedback from both the community and the CHO and regional managers, one common thing that they continue to say that now the community has got more voices to speak. They have gotten some level of power because we have been able to simplify and define indicators for them to follow.
For me, there is a plan for the entire scale-up, to cover the entire country as far as the community scorecard is concerned. We're also mobilizing a lot of resources internally to do this.
Through the community scorecard, inadequate lighting system and water problems have been solved.
So through the stakeholder engagement, we had Ahmadiyya Foundation to donate a polytank. Through the stakeholder engagement also, we got the assembly to get the ECG to help us fix the street lights, which are working now. I am very happy that the community's involvement has been able to make a positive line to the hospital.
Another thing we need to do in standardizing, we need to ensure that the community members' capacities are enhanced to know what to do. Because if they are not well trained on how to conduct the assessment, they will go there and delay unduly, and this can discourage other well-meaning community members in taking active part in the process.
I think the community scorecard has come to stay. We don't have a choice. It is a very critical tool if we truly want to make sure that the voice of the patient and our communities and their families are actually at the center of healthcare, which is what the National Healthcare Quality Strategy launched in 2016 seeks to achieve towards quality universal health coverage by 2030 and beyond.
And finally, Tanzania has expanded the use of the malaria scorecard by training members of parliament on the scorecard, translating scorecards into the local language, and developing a mobile application to give the MPs access to the data on their personal devices. This short video explains in more detail.
According to the World Health Organization, Tanzania is among 11 countries with the highest transmission of malaria. In the fight against malaria, the Tanzanian government has been taking several initiatives to make sure that malaria is eradicated by 2030. Interventions against the disease include the distribution of insecticide-treated nets, indoor residual spraying, diagnosing all patients presented with fever using rapid diagnostic tests, as well as larviciding all mosquito breeding sites. In 2019, the Comic Relief GSK partnership worked with the African Leaders Malaria Alliance to support the United Republic of Tanzania to enhance high-level advocacy and action for malaria with the use of a scorecard. It was launched by the Honorable Minister of Health in November 2019 on SODEC Malaria Day, a yearly event to create awareness of malaria in Southern Africa, and was attended by Tanzanian parliamentaries against malaria, known as TAPOMA. The Malaria Scorecard is a management tool that shows the performance of priority malaria indicators in a simple color-coded format. The scorecard is used at political level to keep malaria high on the agenda.
This scorecard will ease the whole process of accountability because it uses indicators that evaluate the situation based on evidence and give importance to the areas of underperformance.
Using the health service data being reported daily, every quarter, the National Malaria Control Program produces the Malaria Scorecard.
The subnational indicators on the scorecard can help one to gauge the performance of key interventions, such as how many pregnant women are receiving anti-malaria medicine, the distribution of bedness to pregnant women, distribution of bedness to children during vaccination, or one can examine the incidence of malaria within the district or look into the positivity rate of patients.
You can access the scorecard in two ways. The first way is through Scorecard web platform, which can be accessed online via a computer through a web browser. With the aim of easing the use of Scorecard, we saw that it will be more appropriate and more user-friendly to make the Scorecard available through smartphones.
through the malaria scorecard, leaders can better support the implementation of malaria interventions and actions that address underperforming indicators. Tanzania's Parliamentary Committee Against Malaria, TAPOMA, and other high-level decision-makers were trained on how to access and use malaria data to take action.
For example, in two of my districts, Kagera municipality and the municipality of Bukoba, one can clearly see on the scorecard that it is a path we need to follow and where we need to take more action.
Through malaria scorecard, leaders like district commissioner, together with district executive director, during our meeting, there will be discussion about the indicators. Citizens also have a big role to play, and we have been collaborating with them in the fight against malaria, especially when considering a big part of transmission of malaria goes hand in hand with the education. And so far, they have been helping in making sure that we eliminate malaria.
To achieve the goal of malaria elimination by the year 2030, there is a need for leaders to support malaria interventions in their jurisdiction and maintain malaria high on the political agenda. By using data to support the fight against malaria, a zero malaria Tanzania is possible.
I would like to congratulate all the winners of the Joyce Kafanabo Awards for excellence and innovation. It has been a pleasure to celebrate scorecard successes across the continent. I will now hand over to our Executive Secretary, Joy Fumafi.
On behalf of the African Leaders Malaria Alliance, I would like to congratulate all of the award winners for this inaugural ALMA Joyce Kafanabo Awards for excellence and innovation. These 7 countries, Zambia, Kenya, Republic of the Congo, Ethiopia, Rwanda, Ghana, and the United Republic of Tanzania, highlight how turning complex health data into easy-to-understand scorecards can help leaders at all levels identify problems quickly, drive action, and deliver improved health outcomes for all citizens. These 7 winners have shown how important innovation and political leadership is in the pursuit towards the continental vision to end malaria by 2030, to improve reproductive, maternal, newborn, child, and adolescent health, and to defeat neglected tropical diseases. While Joyce Kafanabo passed before her time, she will live on through the many fond memories of her family, friends, and colleagues, and through these awards for excellence and innovation on the African continent. I urge everyone, member states, politicians, senior leaders, health professionals, and youth champions across the continent to continue Joyce's inspiring legacy to advance the health agenda across the continent and create a better future for all. Zero malaria started with Joyce, and it must continue with me, with you, and with all of us together. Thank you, and goodbye.